Dr. Henry, the modeling shows that the Delta variant continues to grow. Yes, you acknowledged it's a smaller number because we don't have as many cases, but are you legitimately concerned that we could get to that point that's shown in the modeling where we're at 80% of contacts and 50% of Delta, and we start seeing those cases climb again? Like, is this how transmissible we believe this Delta variant is?
Yeah, so we've been watching that really closely, and we see there's a whole bunch of different factors that go into it. And I think we have to, and I've said this a number of times, these variants aren't little spaceships out there on their own. They're strains of virus that are infecting people. And we know that the same measures that we take to prevent transmission works no matter which strain of the virus you're infected with. What we have is a much lower margin of error for the variants that spread more quickly. And yes, some of the data from the UK shows that it is more transmissible, but the jury's out on that a little bit. But where we are seeing the transmission happen is in pockets of unvaccinated people. And we saw that in the UK, mostly younger people, which means we're not seeing the same impact on hospitalizations. And if we go back to our goals of the pandemic, it's to reduce morbidity and mortality, particularly serious illness, and to make sure our healthcare system's not being overwhelmed. And we have to balance that with the impacts on society. So absolutely we will be watching, and that's why we do whole genome sequencing on every strain of the virus that we're seeing, because it is likely, given transmission in other countries, and as we start being more mobile, there'll be other strains that come in, whether they arise here or whether they arise in another country and are imported here. So the same things that we do to control the alpha, the gamma, the delta, and whatever new one arises will work. And we've seen that. We've seen that because our cases have come down regardless of which strain people are infected with. And we had an outbreak in a long-term care home with the Delta variant, and it was controlled, and it's now over. So we know that the measures work, and it does involve, we also know that immunization works to protect against all of the strains that we're seeing here. And we're seeing that in the UK, for example, where immunization reduces your risk no matter what strain of the virus you're exposed to. So those are the things that we need to keep working on, watching carefully what strains are circulating, and having our strong public health programs on the ground, which we are committed to continuing to do.